Hello, my name is Dr. Vivian Redeye. I'm a physician currently working at Brooks Medical Center in Dunkirk, New York. I am on the front lines with all the other EMTs and nurses and evaluating patients every day, going into the rooms, the ER, working with patients, touching patients, COVID and not COVID, whether we know it or not.
The vaccine was offered to us through the Department of Health for all EMS. And I jumped on it because I felt it would be more protection for me. For we don't know who has COVID, who doesn't have COVID. I mean, we can have all the protection out there, and then we really don't know if we're going to get it or not.
I qualified to get the vaccine because I'm an essential worker. The nurses here have been working since the onset of the pandemic, and that's how I qualified to work to get the vaccine. The process that I had to go through to fill out the vaccine was to fill out a consent form, which asked me my basic information, like my name, my date of birth, and how I qualified to get the vaccine. I then had to sign also a consent that would be sent to, I guess, the database for everyone that's getting the vaccine.
The process to get the vaccine was quick and easy. You went in, registered, they called you by name, they asked you what arm you wanted to get the vaccine put in, and they administered it. You sat for 15 minutes until they checked for any side effects, and then they sent you on your way.
My vaccine I got on a Thursday. I had 1 day of soreness and slight headache, but nothing major.
After I received my vaccine, I did have one side effect, which was tenderness at the site, but that was the same side effect I had when I had my other immunizations, which were routine, like my update on my tetanus.
The mistrust, especially in our Native communities, which is warranted. You know, we have had a basis for mistrust. But this isn't just about Native communities or Northeast Indians or Southeast Indians. This is about the whole world in a pandemic time. You know, the research for mRNA vaccines has been there. There was just never a push before. But now the money is there. And that's why it was developed so quickly. You know, we have a whole world full of people who are interested in creating this vaccine.
Well, the science behind it, these people have dedicated their entire lives to exactly this. And I think if it's a step toward this pandemic being over, then, you know, you should be on board.
Why I got the vaccine was to help protect myself and the community. But in the end, it comes down to you as a community member is your choice, whether you get it or not.
Well, I'm not a vaccine person, but once I heard about the other virulent strain of COVID, then I decided I needed to get the vaccine to protect myself, my family, my patients, my coworkers.
I received my vaccination a couple weeks ago. I felt it was important to get my vaccination to protect my family. My wife is elevated age as well as having MS and other underlying diseases, and I didn't want to be the one to bring an infection home to her. Secondly is I have responsibilities to that family and to others, and my health, it requires me to be able to work. So thirdly is self-preservation, and I don't think I would like to have to make the decision not to go on a ventilator or that type of thing. Fourth, I worry about the community, that we all get vaccinated to stop the spread of the virus and get back to some normalcy. I understand back in the 1800s when the smallpox outbreak happened that the vaccinations at that time controlled it. So I think we owe it to one another.